Ready? Hi guys! So I know on my last Instagram stories I was talking about A-lines and how to actually manage an A-line and how to connect it and do all that stuff and the supplies that you will need. So as I said before, the things that you will need is you will have your pressure bag and you also have your transducer holder, which is what we have here. You have your transducer kit. Mine's already been primed and it's already been set, so that's why you're not going to see it. And with the transducer, actually has a little cable in it where the transducer cable gets to be attached, so it can be attached to your monitor. So just to recap some of the things that I've said, with your pressure bag, it is going to have this little bob here where we will be able to apply pressure. One thing to note is when you're applying pressure that you do have this little green mark here. For the most part, I don't know if you can see it, that says 300. This is where you want your pressure bag to be set up at. And if it's not, then you can go ahead and push air until you reach that green line, which is gonna be at 300. Okay? And to remove air, you're just going to go ahead and open it to right here, to the bob. You're gonna close it to the bob and the air is gonna come out, and you can go ahead and close it back to air just so you can go back and fill it up with air. Okay, and I'm going to do that right now. A lot of times when you're not getting a good waveform, it's because we need to go back and put some air on it, or maybe your catheter is kinked. But just go ahead and assess the situation and just get a good picture of what is going on with your patient. So you already have that all set up. You do have your patient connected to the monitor, and you already put in optimum scale, so you know that you're getting, good waveform and a good blood pressure. One thing that I would say, especially if you're first coming on your shift, is you want to make sure that you do have a good pulse. So make sure that you do check your patient's pulse, and you make sure that they have good blood flow. You check the capillary refill just to make sure that everything is good. Once you have that all done and your patient is connected, you make sure that there's no air in your line, and you do make sure that it's at 300. So you're ready to go and you have your good pressure. I always say, just to make sure that your pressure is correlating, I would always do a cuff pressure every 4 hours just to make sure that we are treating the right blood pressure. And also I would say note where your physician with the map to be, because if your physician with the map at 65, you want to make sure that you set that up. That way, it's a courtesy to your other nurses to make sure the alarm is not going off every 5 seconds. Okay? So now this is how you set it up, the equipment that you need. One thing that I will note though, if you are drawing blood from your arterial line, is first thing first, you always want to make sure that you do have an arm board. So this will go underneath your patient just to keep the arm straight, just to avoid having any kinks. So what will you do if you have an order to remove blood? So what you will do is, especially if you have a vamp, which works really great, sometimes the line will come with the vamp already, or sometimes that you will not have. Some of them come with a syringe. Whatever your hospital policy has, don't be alarmed, it works the same way. So what you will do is, the first thing I like to do when you're connecting, it should have been already connected if you're drawing blood, but if it's not, make sure that you do clean your port with chlorhexidine wipe before you ever attach it to anything. You try to keep it as clean and sterile as possible. So what we're going to do is, this is the side where you're going to be drawing blood from. So the first thing that you're going to do is I like to make sure that everything is working. I like not to have this filled up as much as possible. Try not to, because then if you are flushing, it's really hard to see exactly if any fluid is going through. So just try not to have it filled up all the way. So what you will do first is, once you flush it, you make sure that your line is patent and it's clean. I would go ahead and make sure this isn't clamped. What you're gonna do first is draw blood. And the chamber here, when your vamp, is going to be filled up with blood. It's typically about 5 to 10 cc's that goes on here. So this is filled up. Sorry, it happens all the time where the clip comes out. If that happens, you just can clip it back. So it's really not that big of a deal. So once you fill this up with the blood, what you're going to do now is you want to make sure this is clamped. Right here, the arrow means open. It's open both ways, and when I turn it this way, that means now it's closed. So the purpose of this is, you do not want to get this sample that you're trying to remove to get into the actual sample that you're drawing. So what we're going to do, you're going to make sure that you clean this port here with chlorhexidine wipes, And you are going to go ahead and grab your syringe. I don't know where my syringe went. Where is it? Okay, my syringe. This part is not normally attached to the vacutainer, so make sure that this is attached because this is what you're going to use. And you're going to go ahead and put this here. It's clean. And now what you're going to do is, with this closed, you're going to go ahead and draw the blood. Just make sure that you do know your order of draw. And this comes out. You take this off. And now you're going to disconnect it from your patient, cleaned it. All right. Make sure you open it back. Give your patient back the blood because that's the whole purpose. And you're going to go ahead and flush it. Which is not flushing. But of course it's a mannequin, so it's not going to work perfectly, but that's the whole purpose of it. All right. Thank you. Love you guys.